All right, boys and girls. So now we are going to discuss our ophthalmology quiz number 40, which I did on Telegram, right? So I have got all the questions with me. So these are the questions, and I'll be discussing the 5 questions one by one. We'll try to give you the hardcore concepts, right? So the first question in DAMS ophthalmology quiz number 40 was retina develops from, you know that there is a prosencephalon and there is a protrusion from the prosencephalon which you call as optic stalk. That optic stalk gets converted, the distal end, into optic vesicle, which later gets converted into optic cup, and this optic cup is going to form the retina. Right now, if you know prosencephalon is derived from or is a part of which layer, so you already know retina will be from the same layer, yes, and prosencephalon is neuroectodermal in origin, and you know that you will not have guavas on a mango tree. अब अगर पेड़ आम का लगाया है तो उसमें अमरूद थोड़ी ना होंगे. नाउ सिंस ऑप्टिक स्टॉक, ऑप्टिक वेसिकल एंड ऑप्टिक कप इज द एक्सटेंशन ऑफ prosencephalon, so automatically, my dear boys and girls, the retina will be from neuroectoderm. So the answer to first question is neuroectodermal in origin. Retina develops from neuroectoderm. All right, okay, now coming over to the second question. Okay, most common site of coloboma is, what is coloboma? Coloboma is deficient tissue, and it happens during the course of development. You know that there is a choroidal fissure which starts getting closed at 33 days of gestation. Right now, if there is improper closure or deficient closure of the choroidal fissure, it leads to development of coloboma, है ना? And you may think that the closure happens horizontally, or some of you may think the closure happens vertically. It neither happens horizontally nor happens vertically. It goes from superotemporal to inferonasal side. So which is the last point to get closed? It is inferonasal. So if I talk about the most common site of coloboma out of the given options, the iris coloboma, it will be, boys and girls, it will be inferonasal. It will be inferonasal. Let me show you an image so it will be better understood. So you can see that this is your optic vesicle, है ना? So this is your optic vesicle and this is your optic cup which is going to form the retina, है ना? So I have already told you that retina develops from, yes, neuroectoderm. Now check this out. Check this out. I want to give you another important question here. Give me a second. Give me a second. I am just going to show it to you. Wait. Yes. All right. Check this out. Check this out. Now, are you able to appreciate this? So this is your choroidal fissure. Can you appreciate the choroidal fissure here? Yes. And this is your optic stalk. This is your optic vesicle. Now, if there is deficient closure of the anterior part of the choroidal fissure, it will lead to iris or ciliary body coloboma. If there is deficient closure of the posterior part, it will lead to choroidal coloboma. It can lead to retinal coloboma, right? So just for the extra dose of information, right? Okay, now you have understood. All right, so coming back to question number 3 now. So space between equatorial zones and posterior zonule is known as, so this is your INI-CT November 2023 question. Before proceeding further, I'll show you something very important. Can you check this out? Can you check this out? So there are spaces which are there in the eye. So one is the space between the equatorial zonules and posterior zonules. This space is known as canal of Hanover. Let me highlight it. So it is known as canal of Hanover. So here the space between the equatorial zonule and the posterior zonule. Now another question, what is the space between posterior zonule and anterior hyaloid face. So this is your anterior hyaloid face and this is your posterior zonule. This red highlighted part, what is the name of this space, boys and girls? This is your canal of Petit. So along with canal of Hanover, I told you another important space which is canal of Petit. What is patellar fossa? Patellar fossa is the place where lens is there. So this is the anatomical position where the lens is there. I hope you have understood. Yes. Okay. So these are three important spaces that you should know. All right. So fourth question. So let's write it. So third was, what was the answer to third question? It was canal of Hanover, which was the option B. Canal of Hanover. Now let's get down to question number 4. So fourth question was, there was an image and the diagnosis was asked. What was that image? Let me show you the image. So this is the image. What is this image? So some of you may say, sir, it is optic neuritis. No, my dear friend, it will not be optic neuritis just by seeing it. So in optic neuritis, there will be disc edema, but in retrobulbar neuritis, the patient will come to the doctor and the patient would say, Doc Saab, I cannot see anything, because of course there is inflammation of the retrobulbar part of the optic nerve. When the doctor will do fundus examination and then the doctor will say, patient, I also cannot see anything. That means since there is inflammation of the retrobulbar part of the optic nerve, the fundus appears pretty normal. है ना? So here fundus means optic disc. So here you cannot see any disc edema. Na? So optic neuritis, just by seeing this, retrobulbar neuritis you may think of it, but just by seeing this you cannot say that it is retrobulbar neuritis, because there must be some history which will be given, RAPD, any history of trauma, any history of multiple sclerosis, and when you can actually see a clue here which is this, so of course it is not at all optic neuritis. Now third option was choroidal coloboma. I have already told you about choroidal coloboma, so let's not get into that right now. The fourth option was PHPV, persistent hyperplastic primary vitreous. Persistent hyperplastic primary vitreous is actually remnant of hyaloid artery. So hyaloid artery is the artery which supplies the developing lens. I'll be coming upon it a little later in the next question, but for now, so what is this then? This is your medullary nerve fiber. So that is the answer, medullary nerve fiber. What happens is there is myelination of the retinal ganglion fibers, है ना, from the lateral geniculate body to the lamina cribrosa, right? And after that the myelination is lost, but when it is carried beyond the lamina cribrosa, then it leads to myelinated fiber appearance, है ना? So then there is appearance of myelin in the nerve fibers on retinal examination, which you are going to see. So this is a clear-cut case of medullary nerve fibers or myelin nerve fiber. So medullary nerve fiber is the answer, which is option B here, right? Okay, now let me write the answer here, medullary nerve fiber. So what was the answer? Yes, medullary nerve fiber, है ना? यही था ना आंसर, medullary nerve fiber. Okay, fifth question. So blood supply of developing lens is all except. So I was telling you about hyaloid artery which is going to supply the developing lens. For that I will show you one image which is very interesting to see. Give me a second. So hyaloid artery is actually supplying the lens via three further vessels. So one is anterior pupillary membrane, second is posterior pupillary membrane, and third is the capsulopupillary portion. So these three are nothing but the branches of the hyaloid artery only. If there is persistence of this hyaloid artery, you call it as PHPV. And you are already aware, you must have, seen in my class me telling that there is Burmester papilla, there is Mittendorf dot, and there is Musci volitentris. These are also the remnant of hyaloid artery only. But if there is entire hyaloid artery which is left, which is remnant, it is left, yes, you call it as PHPV. So the question was blood supply of developing lens is all except. So one option was anterior pupillary membrane, second was capsulopupillary portion, third was posterior pupillary membrane, but fourth was equatorial pupillary membrane. Equatorial pupillary membrane, boys and girls. No, it is not amongst the three branches that I have given in the options. So that will be your best answer. So here the answer is D, which is equatorial pupillary membrane. Equatorial pupillary membrane. So boys and girls, so these are your 5 answers to the quiz that we did yesterday, and I hope to do more quizzes. If you want to follow me on Telegram for more such quizzes, so my handle is DAMS Ophthalmology Academics. DAMS Ophthalmology Academics. Yes, DAMS Ophthalmology Academics. You can also follow me on Instagram. Instagram ID is I_Manish. And on DAMS, on this Telegram group, so you can follow the channel Ophthalmology Academics, yeah, Ophthalmology by Dr. Manish Chhabra. So I'll be happy to see you there. And yes, best wishes. Will be doing quizzes quite frequently now, and we'll be having such discussions, and I'll be uploading such discussions on YouTube. Even if you are having any doubts in ophthalmology in any topic, so you can always send me a WhatsApp. I'll try to respond to you. I'll try to clear your doubt ASAP, as soon as possible, right? Chalo, best wishes from my side, and keep reading, keep enjoying life, है ना? Chalo, bye bye.